Para todos, solo vamos a dar un minuto para que se terminen de incorporar otros participantes.
Good morning, everyone. We are giving a few minutes for the rest of the people to join.
Sessions, just give a couple seconds. Bien, muy buenos días para todos y para todas. Bienvenidos a este webinar.
Good morning, everyone, and welcome to this webinar. I am giving just some information in the lower portion of your screens. You will find the interpretation icon, which is a globe, and you can choose your language, English or Spanish, or main. Also, in the lower portion of the screen, you will find a Q&A button, which you can use for asking questions as we go, and we can read these questions later on.
In the bottom of your screen to select your preference for English or Spanish translation. And then you will also have the Q&A button in the bottom of your screen to make questions and questions during the session. And they will be made to the panelist or to the at the end of the presentations. Okay, so now I give the word to Leo Netherbean, who will be doing the opening remarks.
Thank you very much, Luis. I'll do the opening remarks on behalf of Dr. Hennes, who unfortunately has another important meeting where he has to attend. So welcome everyone. Good morning to all, and thank you for participating in this webinar. Non-communicable diseases, particularly cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases are responsible for almost 80% of all mortality. NCDs can be prevented by reducing their main risk factors: tobacco use, harmful use of alcohol, unhealthy diets, and physical inactivity. The WHO Best Buys are powerful tools for the prevention and control of non-communicable diseases. Several of the interventions recommended in the WHO Best Buys include mass media campaigns, implemented as part of a comprehensive set of policies instead of isolated interventions. In this context, mass media campaigns have been used to create public awareness, to change social norms or advocate for regulatory policies, for behavior change, for sodium intake reduction, or to warn the population about the harms of smoking or tobacco use and secondhand smoke. On the other hand, marketing has been used as a tool to persuade people, particularly for commercial applications. For example, food marketing predominantly promotes foods high in saturated fatty acids, trans fatty acids, free sugars, and/or salt, using a variety of strategies affecting people's choice and ultimately consumption. However, marketing can also be used to create positive social change through social marketing, which can be defined as the use of commercial marketing techniques to achieve the common good. The Pan American Health Organization, together with the WHO Collaborating Center on Social Marketing at the College of Public Health, University of South Florida, and with the financial support of the American Heart Association, launched in July 2020 an online program on social marketing for public health as a tool to build capacities in public health professionals in developing and managing social marketing campaigns. The program is offered in English and Spanish as a self-learning or tutorized modality, and is hosted by PAHO's Virtual Campus of Public Health. The curriculum consists of a self-learning course, Introduction to Social Marketing for Public Health, followed by a second course, Planning and Development of the Social Marketing Program for Public Health, of 4 modules. Upon completing the two-course program, participants will be able to direct or supervise social marketing programs in their territories, making informed decisions and apply a systematic 5-stage process that ranges from problem formulation to monitoring and evaluating the plan. More than 16,000 participants have registered for the introductory course. Additionally, a cohort participated in the Tutorized course guided by a social marketing specialist, both in English and Spanish, and developed proposals for social marketing campaigns. The topics selected are related to decreased sodium intake, decreased consumption of ultra-processed foods and sugar-sweetened beverages, promotion of physical activity, and tobacco use, among others. Social marketing campaigns have to be implemented together with actions to modify the environment, making the healthy choice the easy choice, especially among children and adolescents as well as their caretakers. During this webinar, we will hear an overview of the program from the director of the WHO Collaborating Center on Social Marketing and from the participants of the Tutorized modality from Aruba, Costa Rica, Panama, and Sint Maarten. They will share their experiences and lessons learned in the program, and particularly the development and implementation of the proposal for a social marketing campaign. So welcome all of you to this session. This is the first webinar we organized after we launched the program 3 years ago. So first we are going to see a video that has been prepared 3 years ago to disseminate this program of social marketing for public health. And just to mention, this program is still open for anyone who would like to participate. We will share the links with you. So let's first have a look at the video that we prepared 3 years ago. I can't hear the sounds. I'm not sure if everyone has been able to hear the audio. At least I couldn't. But if not, we will try to show the video later during this webinar. For now, let's move on with the agenda. And our first speaker is Mahmouda Pasha, and she is the director of the WHO Collaborating Center for Social Marketing at the University of South Florida, at the College of Public Health. So she will give us an overview of the program on social marketing for public health and its implementation. We have been partnering with them in the development of this program. So welcome, Mahmouda. I hope you're not much affected by the hurricane, and you have the floor.
All right, thank you very much, Leo. Good morning to most of you. Yes, we are fairly safe here in the Tampa area, but the hurricane is hitting the northern parts of Florida. So we're hoping that they remain safe as well. The purpose behind my presentation today is to really share with you an overview of the program that we implemented, also to provide you with a history of our center and our relationship with PAHO, and then to transition it into the presentation that will be given by some of our country partners and the work that they accomplished over the course of the last year that we've been implementing this. So if you can go to the next slide. So as Leo shared with you, my name is Mahmouda Khalik Pasha. I'm an associate professor of social marketing at the College of Public Health at the University of South Florida. As part of my responsibilities, I also serve as the director for the WHO Collaborating Center on Social Marketing. And the reason we have the center established at the University of South Florida is that we have we've been held in high regard around the world as a center for social marketing at the University of South Florida. We're one of the only academic programs that exist in the world where you can come and get a master's degree or a certificate or a PhD in social marketing. And we've had multiple centers. And due to our work in the field of social marketing, the WHO recognized us as an expert on this area. And in 2014, we were designated as a center for the WHO. And we have since been redesignated in 2018 and most recently in 2022. As part of this designation, we've collaborated with PAHO as well as many of the country partners in Latin America on multiple projects. So we can go to the next slide. The mission of our center is to address the growing problem with the non-communicable diseases by capitalizing on the strengths of social marketing coupled with social change strategies. The center of our focus, or the main pillars around which we focus our work, are related to training and technical assistance, and then also building capacity and knowledge exchange in the region. Next slide. So we have a long history of working with PAHO and in utilizing virtual platforms to educate the public health workforce. So the development of the courses that I'm going to present with you and the screenshot that you see here is just one part of it. But we've been collaborating with PAHO through our social marketing conference, which is one of the longest running social marketing conferences in the world, and the training academies that we provide. We've been previously using the Carmen Virtual Public Health Network that PAHO had as a way to provide online education. And then now most recently, we've been using PAHO's Virtual Campus for Public Health to host this new course, as well as the courses that we've developed for them before. Another collaboration that we had with PAHO, as well as many partners in the Latin America region, was a project that we had funded through the International Development Research Center, and we work with 5 country partners, one of which I think you'll hear from today, as well as they're one of the presenters for this webinar. Next slide. So some of you may not be familiar with what I mean when I say social marketing, or when you heard the word social marketing. So I wanted to give a little bit of an introduction to what is social marketing, so that way you have an understanding of it prior to us going forward in talking more about what we actually went about doing. And so basically, as we know that we're facing very complex challenges, and in order for public health professionals to be ready to address those challenges, that they need to be aware of more innovative approaches that are available to them. As Leo shared with you at the very beginning, social marketing has been listed as one of the best buys by the WHO and is one of those innovative approaches that can be used. Said shortly, social marketing is an approach to behavior change that uses traditional marketing or commercial marketing tools to promote sustainable and positive social change. So what does that mean? So what that means is that we focus most of our attention on really understanding the individual, the consumer, or the population, or the audience, really understanding them. So everything that social marketing develops is user-focused and developed with the user or the individual at the heart of it. So how do we go about understanding the user? We understand them by using research or doing listening. And once we have listened to them, we gain insights into why they do what they're doing, what would they like to get out of doing the behavior that we would like them to do. And using that information, we go about developing a marketing strategy to encourage them to make a change in their behavior. And this in turn results in a larger social good for us as a society. Next slide. So as I shared, that listening and research are the primary components of social marketing. So once we do the listening and research, it helps us to understand the person better or provides us those insights. And then we use those insights as a way to then target better from a behavioral standpoint. Also, to segment the population, meaning not looking at it from a one-size-fits approach, but focusing on the specific segment of the population, and then understanding what they're currently doing, and then using that information to develop a marketing mix. Today, as you will listen to the presentations by the panelists, you will see this come to fruition as they share the information that they embarked on as they went about tackling their public health topic. Next slide. One of the other things that I really wanted to emphasize is the relationship of the social marketing to this concepts of social determinants of health. Because sometimes I feel that they're not seen together as one and the same in some respects. For social marketers to be successful and for them to select a behavior that a product or a service that is applicable to their population, they have to look at it from a systems-based approach. So in unpacking the public health problem, understanding why it exists, we have to have a better understanding of what is influencing the environment and who are the influencers for the audience. And so in using this systems-based approach in unpacking the public health, we often understand how these social determinants of health are impacting the health problem that we're working with. And we often focus on those specific determinants as an initial step in guiding towards the behavior change. So we look at the systems-based approach. And one of the interesting things to note is that we often may think about behavior change as something that's done at the individual level, but as you will see in the presentations, that in order for us to have a change take place at the individual level, we have to influence the stakeholders, which is midstream, and we have to influence the decision makers, so the policy makers, that's upstream, because only when you get a change happening at those levels can it be easier for somebody who's an individual or the population to make a change at that level. So next slide. Another thing to note with social marketing is that social marketing moves beyond just mass communication or public awareness or to go about getting the behavior change. In relation to the issue of SALT, which is what you're going to hear about a lot, SALT reduction in some of the panelists' discussion, it has been noted by multiple researchers that we're not going to make a change on this topic if we only focus on education, because education itself is not enough to get the change in behavior. In order for us to get a change in behavior, we have to influence not only the individual, but we have to move upstream in relation to decision makers and policymakers. And what this can look like is that we can work together using social marketing to decrease the demand for salt or high salt products within the household, but we can also use it as a way to generate demand for low salt or salt alternatives. But that involves us working not at the individual level, but also within the larger policy environment. Now, next slide. So I wanted to give you kind of that background as to what social marketing is and the different levels in terms of where we intersect or we can interact. And now I want to move us towards talking about what we actually did. And so this program on social marketing, as it was mentioned, we launched this program in 2020. That's when we developed this curriculum. And the curriculum is 5 courses that we have, but it is designed for, public health professionals from around the globe to go about utilizing it. We've had many people, access this information, and then we've had some, which you're going to hear about, who've actually gone about using it with working with us in providing them the technical assistance. But what I'm going to share with you is work that we did in using this course in a tutorized manner, which is working with country teams from around the Latin America and the Caribbean region between July of 2022 and now at the current point that we're in. So next slide. The way we went about structuring this tutorized course is that we based on language. And so we had 2 cohorts that we had working simultaneously. We had one cohort that was from Latin America that was working on this course in Spanish, And then we had another cohort that was working on the course in English, and that was from the Caribbean region. And one thing to note is that when we created these cohorts, we asked the cohorts to be determined based on countries, like which countries they're focusing on. And then once the countries had formed teams, then we moved forward from them in terms of asking them to select a risk factor. So are they working on physical activity? Are they working on nutrition? What's the health topic? Do they want to tackle alcohol, tobacco? What's the public health topic that they're going to select? Once they had gone about selecting that, then we moved through the course itself in getting them through that. Next slide. The individuals who were providing the technical assistance throughout, I wanted to make sure I introduced some of my other colleagues who've been instrumental in guiding the teams through this work. So I was the lead for the Caribbean cohort, which was based on using English. And with me was Angela Macris, who's a PhD candidate in the College of Public Health at the University of South Florida. Alongside me for the Latin America cohort, we had Dr. Ishmael Hoare, who's an associate professor in the College of Public Health at the University of South Florida. And working alongside him is Villarmina Ponce Lucero, who's a social marketer from Peru and has a long history of working as a social marketer in the region. And so they were guiding the Latin America cohorts while I was working with the Caribbean cohort. Next slide. So the way the program is set up is 5 courses, and each course has around 4 to 8 lessons within it. And the lessons are quite interactive. It's not information at you. We provide information, provide practice examples, and then you apply it to a topic that you're working on. So the goal is for you not to just get information, but to get your hands dirty and to get experience on it. The very first course, Course 1, Social Marketing for Public Health, it just provides an overview of what is social marketing and shows social marketing in action on various health topics. So breastfeeding, heart disease, tobacco use, other topics of that sort, but it just shows success stories of social marketing in action. Following this initial course, which all the teams did on their own, then we moved into course 2 to 5, which focused more on the different planning stages. And so you see here that from July to December of last year, we had courses focusing on the planning component of it, and then planning for the research element. And then we took a break where the countries went out and they collected data, and they analyzed the data, and they understood what the insights were. And then we met once again between January and June of this year, where we used the data to inform the social marketing plan or the communication-based strategies, along with the monitoring and evaluation plan. And you will see that the presentations that they will share today are structured in this manner. Next slide. So just to give you a kind of an overview, you do not need to focus on reading everything that is presented here, but I just wanted to show you the level of commitment and work that took place. So from Latin America, we had around 8 teams from the region, 8 countries participating. And at times we had multiple teams within a country working on different topics. And so the topics that the teams were tackling included obesity on different elements of it, HPV, hypertension, and alcohol consumption. And as you'll see, the audiences were quite different. The audiences ranged from working with elementary school age children to adolescents, to parents of those children, to even Ministry of Health officials and staff, so employees in a work-based setting. So that was for Latin America. The next slide. This is just an illustration of some of the activities that they accomplished, just to show you the type of work that they generated. What you're seeing here primarily is one of the activities that they do early in the course, which helps them to go about selecting the behavioral focus. And so these are the return on investment charts that the country teams developed as a way to select what is our behavioral focus going to be, that will then in turn drive the selection of the audience that they're going to be working with. And so this is an example from Puerto Rico and then one from Panama, and you'll hear more about the Panama one later today. Next slide. For the Caribbean region, we had around 7 countries working on there as well. And again, the topics were related to hypertension, obesity, and alcohol use. And the audiences that we had here were working women and parents and children, as well as similarly employees. Next slide. So this is again showing you just an illustration. This is not at the planning phase, but more later on, once they had developed their communication strategies and had developed concepts for some of the countries. So here's Bahamas, Suriname, and Trinidad and Tobago, and how they translated their research into communication-based, concepts. And then these concepts were in turn tested with their target audience prior to rollout with community-based activities. Next slide. So overall, we had around 80 hours of course engagement with our various country teams. So it was really a lot of time and effort was committed. The country team submitted around 15 different assignments or learning activities as part of the course. We had over 6 months over which we had weekly office hours. So we met with the country teams in the Latin America and the Caribbean cohort. And sometimes these office hours were once a week or multiple times as needed by the country members. So we had over 20 one-on-one country cohort meetings with tutors. Over 15 course-specific resources were sent to the individuals as well. The interesting thing to note in terms of what is the outcome or the product, we had 14 social marketing strategy formation workbooks that were created. And so in creating these workbooks and then down the line developing a communication strategy, keep in mind that 14 countries engaged in research in their countries with the target audience, synthesize that research and then use that research to develop a social marketing strategy. So we had around 14 countries do that at the end. And then at the end, around 17 people from the Caribbean region and around 12 from Latin America received certificates of completion for going through the entire course and then all working alongside us. So next slide. So one of the interesting things that we had this time is that we wanted to move the countries through these courses in planning for a social marketing intervention. But this time around, we wanted to move beyond just planning and also to support some of our country partners in the implementation component of it. And so for the implementation, we had some funding that was, again, generously provided by the American Heart Foundation and Association and their work. And so we were able to support Aruba and St. Martin, as well as Puerto Rico. You will hear from Aruba and St. Martin today. Puerto Rico, their work is still in the planning phases. Next slide. So these countries were provided the funding to provide support for the implementation. And as part of this work, USF, or the University of South Florida, and our collaborating center continued to provide technical assistance to support the countries as they went about developing, implementing, and evaluating their interventions in the field. And the panel discussion will showcase this work that has been ongoing for the last couple of weeks or months that we've been working with the teams. So next slide. So before I pass on the information to the country teams for them to share information with you, I wanted to share some of the lessons learned that we've had from our implementation. And this is lessons learned from the perspective of implementing this course and what we gained. One of the things that we found is that we had to add time and effort to the formative research. For the core, formative research is the listening and the research element of it, because we wanted to make sure that the countries didn't just receive information from the virtual platform, but they actually went into the field and applied what they learned to gain an understanding of how important formative research is to the social marketing process. And so that was an important lesson learned that we did, and we incorporated it into the timeline. In the future, we are also recommending that we put more time to accommodate for this research in the field. And one of the other interesting things, and you will hear it from our panelists, is that the panelists added this activity on top of their other activities that they were doing as their full-time job. And so they had to really balance the commitments required for this course along with their work. And so one thing we emphasized to PAHO, but then also to other countries, is the element of that if other staff want to go through this course in a similar manner, that there will need to be more time dedicated to it and more time given by the supervisor for them to be able to benefit truly from what the course is intended to accomplish. Next slide. So the next, what you're going to do is you're going to hear from the panelists about their experiences. One thing I wanted to share with you, and we will be disseminating this later in the year, is that we're taking the lessons learned, the case examples from our implementation, and we're developing a social marketing toolkit or manual that is focusing on SALT reduction. And this toolkit and manual is currently in the development phase because we're using the case examples from the country teams that are going to be presenting to you as illustrations of the social marketing process and what they were able to accomplish, what they were able to learn. And we want this tool to serve as a way to not only guide other country teams and public health professionals on how to use social marketing, but then also to learn from the experiences of other teams in understanding that you may need to account for this, or you may need to do this, or you may need to adapt it in this manner to fit the context in which you're working. And so this manual should be complete by the end of this year, and then we will likely have another webinar or some activity as a way to disseminate this and share the information with you and others who are on this call. Next slide. So I've shared my contact information with you here. We have a question and answer area as well. So if any questions come up related to my presentation, please post it there. But then any other questions that will come up for the panel discussion, please post the questions in the Q&A and we will come back to them during the Q&A part. So now I'm going to move this back to Leo so that he can go about introducing the panelists so that they can share their experiences of implementing this program at the country level. Leo?
Yeah, thank you very much, Mahmouda, for this comprehensive overview of the program. And as Mahmouda said, any questions, please use the Q&A button, preguntas y respuestas, and we will be answering the questions in this QIA button. So just to emphasize as well that although in this course we have been emphasizing risk factors for non-communicable diseases, this social marketing planning approach is applicable to any public health topic. So what you will learn in this course is really how to do the planning from formulation to the problem until monitoring and evaluation and passing all the stages of the process, which will provide a more high quality campaign and more impactful. And we have shared the links of the course on in the chat as well. So please, if you're interested, you can do the course and you will get a certificate and you can disseminate the course as well among your contacts. So let's move on now to the panel. I'm going to switch to Spanish. Vamos a escuchar ahora unas experiencias de los países.
We are now going to hear about country experiences, those who have worked with the tutorized approach. We will have a presentation by Dariana Evans and Sana Van Campel from St. Martin's and Aruba, and they're going to speak about the salt intake among women who work in a hotel setting there. There will also be a presentation by Samuel Escudero from the Ministry of Health of Panama. He will speak about how to reduce salt and sodium intake at the Ministry of Health. And after that, we will have a presentation on how to reduce the use of sweetened beverages among adolescents from 17 to 22 years old, and that will be by Carol Madriz from the Health Research and Technology Unit at the Ministry of Costa Rica. Each panel member will have 10 minutes, and after that, we will have time for discussion. As I said, we invite you to share your questions in the Q&A. With that, I turn the floor over to our colleagues from St. Martin's and Aruba.
Good morning, all. Thank you for the opportunity and allowing us to present our social marketing project. As previously mentioned, my name is Dahariana Averts, and together with my colleagues Ebrina Kurat, Iraida Tyson, and Patricia Puerto, we're presenting this as a collaboration between the Ministries of Health and Ministry of Sport of Aruba. Next slide. Yes. Our goal is to assist in awareness and education to the community to consume less salt. Therefore, social marketing was the perfect tool for us to use in order to accomplish this. During our health campaigns, in which we provide free health checks in Aruba, we educate as well for the working demographic. We have analyzed that both men and women are not fully aware that their daily meal choices are not healthy. Next slide. So in discussion, we've realized that their perception of health is purely based on conversation, guessing. So that means that they haven't sought advice from healthcare professionals in order to be educated or receive full awareness of what they are doing. So their choices may cause diseases such as high blood pressure or NCDs, other NCDs, and this is both partial for the men and women in high percentages. Next slide. So what is the issue and what does this actually mean? That they are being made are based on convenience. So a lot of their choices is convenient. A lot of them is based on what is accessible to them. And the processed food is one that is of their many choices. It's a lot of salt consuming and a lot of sodium. And we know that salt consumption is known to be one of the big risk factors in developing the high blood pressure. And this results in the lower quality of life here in Aruba, the work performances, and consequently, a higher health cost for the people that are absent at work. Therefore, our ministries consistently collaborate together and educate in the community of Aruba and using social marketing as our health promotion tool in creating a better quality of health and adapting positive social environments for all of their local inhabitants. Next slide. It is important to mention that we are currently working on guidelines regarding the salt consumption. While there is policy regarding the NCDs, but therefore, there's the initiatives with this social marketing tool, and the campaign is to bring the necessary impact and consequently develop policies on this subject. For our segment audience, we broke it down in three aspects. The primary is the working women within the Hilton resorts between the ages of 35 and 45, full-time or part-time working. The secondary, which will be the one they are impacting, which is their families, their co-workers, and other working women outside of the Hilton resort. And the third part is the collaborative hotels and the management team that are once responsible for the part of nutrition, food and beverages that is consumed on their practice and on their work. It's important to note as well that the campaign will not only be used at now, but we're going to be continuously using it throughout the year in other campaigns as well. So, as previously mentioned, the goal is to increase the awareness and promote salt reduction measures for the health benefits with multiple outcomes. For example, the understanding how much salt should be consumed for a better quality of health, understanding how to read labels, and as well as understanding how alternative ingredients such as spices and herbs can be used instead of salt. One of the analysis that we did, we can go to the next slide. Yes, is that the specific themes were highlighted in the analysis. 10 themes in total, but we just want to focus on two today, which life is tough. So good healthy food is expensive and takes too long for the preparation. So they tend to shortcut using canned or processed food, as I mentioned before. And as well as cooking for and with family when they cook, they also think about the traditional recipes that they use and the ingredients and traditional methods of cooking as well. So, which means is our branding, product, and design needed to be something that's inclusive toward their family life, making the healthy choice the easiest choice for them, and connecting their healthy choices with a traditional meat, which for them was very important. So, we shared on some of our examples. You can go to the next slide. You can see the colors based on our pre-testing phase. The colors were chosen by the working women. They want something that was not just gender neutral, but something that can be mixed. Their logo design was their choice. They wanted to see familiar faces. They wanted to see a professional. They wanted to see the meal and something to connect on their emotions. As well, they said that one of the branding aspect is the logo. They want to be able to recognize it in a very powerful logo and the signature that was going to be used as well. Next slide. There is a video on this. We can show a few seconds of it.
It says access is needed. Is it on a Google Drive?
Yes, then we're gonna share this area. I hope for the PowerPoints to be able to be shared amongst the other colleagues as well. If we go to the next slide. Yes. Lastly, our monitoring and evaluation of this project is still ongoing. At first, we have three interventions. The first one will be from the data collection that was done in the pre-survey before our branding design was completed, understanding the knowledge, the highlights, and the themes that were present. The second and the third intervention, that's the moment that we're going to be really implementing our branding design, our campaigns, and all of the information that we've gathered. That will be used for awareness, education, and starting in this coming week, actually. And this will be done through social media, TV, radio. So we're going to be doing a media tour. We have a health expo on the 23rd of September here in Aruba as well. And that's going to be accessible for the whole community. And what we will do is do a post survey as well in the month of February of next year in order to see if the information that was provided to them brought clarity as in what salt consumption means, what sodium levels are, and how to read specific labeling and making, if indeed they made changes into their lifestyles to have a healthier lifestyle as well. And the third intervention, as you can see here, is to provide alternatives to the audience and the working women by working with the managers. That means all of the information that we are going to be providing is going to be provided to their managers, to the food and beverage distributors as well, in order to provide different variety and access to multiple products and substitutes for the community as well. Next slide. Our learning outcomes from the social marketing course, this is something very important, is what we've learned is to recognize the benefit of social marketing as health promotion tool for the public health. And this is the knowledge that we've shared not only with the public health ministry, but also with the sport and the social. We've created programs that are positive for the behavioral changes, where we highlighted the benefits and especially showcasing the positive behavior outweighs the negative. Very important to increase the knowledge and the methods to make it the healthier choice, the easiest choice, providing them with the resources that are accessible for the community in total. As well, the creating of the communication plan. This was indeed for us very specific because we had to design and adapt according to what the audience wanted as well, and the plan of using the specific data that we received along the way to target our segmentation and customize our programs. And lastly, the understanding of the branding and the implementation and the impact that it has throughout the process, and how this can be best monitored and evaluated in order to be used as a tool for other campaigns as well. Next slide. That's a little bit for us. Our campaign is called Más Salud, Menos Salo, cu sabor de casa, which means more health, less salt with flavor of home. So on behalf of the One Happy Island here in Aruba, we want to say thank you, and gracias for your attention.
Dankjewel, muchas gracias. Thank you very much. So we continue now with the panel with the next presentation. And this presentation will be done by el licenciado Samuel Escudero del Ministerio de Salud de Panamá. Él nos va a hablar de la disminución
From the Ministry of Panama, he will talk about the decrease in use of sodium and salt intake.
Sorry. Okay, adelante. Then we listen first to St. Martin.
Okay, thank you very much, Leo. I hope my camera is working. I'm not sure about it.
Yes, we can see it.
Okay, yeah, I can't see myself, but okay, it's working. Great. Thank you very much. I'm Sanne van Kampen. I'm the advisor on non-communicable diseases of the Ministry of Health in Sint Maarten. And I'm now going to share with you our experiences with following the social marketing course and developing public health and social behavioral change campaign for reducing salt consumption. Next slide, please. So first, a little bit of background on Sint Maarten. Sint Maarten is a very small country in the Caribbean. Data from 2015 shows that 32% of adults self-reported to have a high blood pressure. So that's rather high. We realize salt consumption is an important contributor to hypertension. And although the government of St. Maarten regularly implements public health awareness campaigns around healthy eating, we haven't had one that specifically focused on salt reduction. And we haven't had one that used social marketing techniques to develop such a campaign. Next slide, please. So in the course, we worked very closely with Aruba, and we adopted the same focus and population target for our campaign. So our aim was to reduce salt consumption and use among working women between the ages of 35 and 45, employed at large hotels. And this group was specifically chosen, first of all, because there was preliminary data available amongst this group about their healthy, their behavior with regard to healthy eating. So we did a bit of insight into this group already from Aruba, and also it was realized that this group has limited resources in terms of income and time, usually, to eat healthily, and also they are important stakeholders in. They are usually, the primary caretakers of their families. So changing their behavior would impact on their families as well as the community as a whole. So introducing our team, there's myself, and I work at the more policy department of the Ministry of Health. And we have our colleagues, Ivanka Sterling and Swinda Richardson, who are working in the health promotion team of the ministry. And we work together with the University of St. Maarten, and Raymond Jesseroen is the researcher from that university that helped with the formative research. Next slide, please. So for our part of the formative research, we interviewed 14 women working in Oyster Bay Beach Resort, one of the 4 large hotels in St. Maarten. And we assessed their knowledge, perceptions, and behaviors with regards to home meal preparation, shopping, as well as takeout food. And basically, the results show the following main findings or actionable insights. So we realized from talking to these women that they're not exactly aware of how much salt is consumed, mostly because salt is hidden, is part of other products that they consume. And yes, it's hard, they don't have usually a lot of time to read labels in the supermarket. So the other finding was that they don't usually use a lot of fresh seasoning or herbs to season their meals, but rather prepackaged spice mixes, for example. Also, to save time, meat and other products are often defrosted using salt. Most women consider frozen vegetables not as healthy as fresh vegetables. Since fresh vegetables are very expensive, they often opt for canned vegetables and other products, which then often contain salt as well. And finally, most women have not a lot of time to cook at home, so 2 out of 3 meals come from the workplace. Next slide, please. So, St. Maarten, again, in collaboration with Aruba, developed a communication plan for the social marketing campaign, and our main message was less salt, more health. So it is an English-speaking country, St. Maarten, in principle. We do have a lot of Spanish and Creole speakers as well, not a lot, but some. So we will be translating our messages into those languages as well. And what we realized was that we had to focus on, what motivates these working women, what are their barriers. So we found that for them, it's very important to feed their families and keep them healthy. That's basically their main concern. So they were open to learn new ways of cooking, but they wanted to keep with tradition and with traditional flavors. And the way they get information is usually through family, friends, and social media. Their main barriers to healthy eating are limited access to fresh food due to the very high prices of vegetables and fruits, for example, a limited time to cook healthily, and they are reliant on old habits, again, due to time, mostly with regards to shopping and seasoning. So we said, okay, our main aim should be to change behavior, and to change their behavior is for them to teach them how to choose alternative food products or cooking techniques with less salt that are healthier, but do not cost money. Next slide, please. So we developed 3 activities. The first one is we're going to do cooking workshops for the female hotel staff in all 4 large hotels. So NIPA, that is the National Institute for Professional Advancement. They have chef instructors. They have worked out a curriculum for these cooking workshops, and we'll provide 2 workshops in October, November this year. And we're going to assess the outcomes of these cooking workshops by doing questionnaires before and 3 months after the workshops, assessing their knowledge, perceptions, and behavior regarding salt use of the participants. The second activity is that we have, together with a graphic designer, designed signs to be placed in supermarkets. We call them wobblers, that try to convince or motivate people to reduce the consumption and procurement of high salt products. So we'll place them in the aisles with high salt products, as well as the alternative products. We'll display those wobblers in four supermarkets over the course of 4 months this year. And we're gonna try to evaluate the decrease in supermarket sales of high salt products from now until the third activity is we're going to advertise on social media, especially on the government Facebook pages, using messages that have been designed by the graphic designer again, that are similar to the wobblers in the supermarket. And we're going to evaluate the estimated number of social views on the Facebook page to evaluate that activity. Next slide, please. So this is the first draft, let's say, of the graphic design of the wobblers. The social media ads will look similar. And yeah, we didn't have the capacity to pre-test these among the target population, but with input from Muda's team, we've had very good advice on how to adjust this and finalize these images. But it will, the graphic, yeah, they will look like this, but we're tweaking still a little bit the text and the image. Okay, next slide. The cooking workshops, yes, we have held similar cooking workshops in the past with NIPA, and we're going to do the same later on this year, but then with specific focus on, alternative cooking products and techniques to reduce salt. Final slide, please. So basically, we're finalizing, as next steps, we're finalizing the designs of the social media ads and supermarket signs. And we're finalizing the cooking workshops curricula. And then the lessons learned for us from following the course and developing the social marketing campaign was, first of all, we realized that we shouldn't focus really on the barriers that people are facing to healthy eating, but more so even maybe on motivators. What motivates them to change their behavior, because they are willing to change behavior, at least our target population was, but we had to find out what really would motivate them to do so. And secondly, we realized how much time it took and how much meetings to sit with the graphic designer to create the designs, the creative concepts for this campaign. So that really is a lesson learned for future campaigns as well. That the researchers and the graphic designers have to sit together many times to go over these concepts. And then finally, we now realize the importance of monitoring and evaluating the campaign. Something that we haven't done before, but it's of course gonna, yeah, give a lot of information for us on the success of the campaign going forward. So with that, I want to thank you and looking forward to the questions from the audience. Thank you.
Thank you very much, Sanne, for this interesting experience. I see there are already a few questions in the chat. Maybe you would like to answer them in the chat. And after the panel, we will have a discussion. But let's now listen to Panamá. Tenemos con nosotros el licenciado Samuel
We
Escudero.
have Mr. Samuel Escudero Gonzalez from the Ministry of Health, and he's going to be speaking on how to reduce salt intake in Panama, salt and sodium. Good morning to everyone. Thank you for the opportunity. Unfortunately, the colleague who worked side by side with me throughout this whole process is sadly, well, not exactly sadly, but she is on leave, on maternity leave, but she will not be able to be here with me. She's Arelis Aguilar. She is a nutritionist and she worked with us throughout the process. Looking at the background, in 2019, a study was carried out to assess the impact of salt and sodium intake in Panama, and the main findings included high blood pressure and its impact on heart disease. And this was related not only to the intake of salt, but also to high sodium products. 77% of deaths were connected to NCDs, 30% to cardiovascular causes. 42.3% of interviewed adults had high blood pressure, and 27.8% answered that they always or almost always added salt to their food while they were eating or before eating. And 45.1% of the population over 15 said that they ate foods high in sodium at least once a week. After this, we moved to implement the National Strategic Plan for the Prevention and Control of NCDs and their risk factors. It is a 10-year plan, which is in effect until 2024. Resolution 049 was a ministerial resolution which established the requirement for restaurants to remove salt dispensers from the table. And then there was also a action plan to reduce trans fats and salt, and this was supported by PAHO and WHO. Given this situation and given that we realize that the adults who consume foods high in salt and sodium were more likely to have high blood pressure, and also that there was no national policy calling for the reduction of salt and sodium, we started discussing including information on the front label of foods, indicating not only their salt and sodium content, but also the content of trans fats and saturated fats. This bill is still under discussion by the Congress. And as aggravating factors, we're looking also at media exposure, where these products are marketed despite the fact that it is known that they're high in salt and sodium. One of the disadvantages of being a multicultural country like Panama is that many people came to Panama bringing their cuisine, their way of preparing food, and their use of different kinds of seasonings. And we know that many people came from Asia and they use seasonings that may have a negative impact on health. So this contributes to the current situation in Panama. It's part of our habits. We use salt or seasonings, and that makes food better. Food is tastier when it is salty and when it has been highly seasoned. Now, looking at the results we used to develop the strategies. Looked at the use of natural seasonings to reduce salt consumption. We also looked at cooking time. This is something you can measure when you prepare food at home. We tried to get the participants to reduce the amount of salt they use while preparing foods. And we also encourage them to make food at home rather than buying takeout food and bringing it home from work. And we also looked at the time this took every day. So the main findings, these were results from an online survey. Each of the participants filled out a form and were able to identify the obstacles. They identified the negative behavior, benefits, and motivating factors, people who influence decision making, places, and dissemination channels. We set up a focus group in order to obtain as much information as possible, information to be used to develop the strategy. Among the obstacles we identified and how to address them were the following measures. One was to plant and organize home gardens or orchards, because this made it possible to access food that is easy to grow. One example is cilantro, which we call culantro in Panama. It's used to season foods. It's very aromatic. It's easy to plant and grow. No specialized knowledge is required. Another activity which was or measure identified is that these seasonings can be refrigerated. It's possible to blend them in a blender and keep them in a refrigerator so that they don't spoil. The other measure was planning food shopping, making lists, and make sure that the foods on the list were natural and fresh. Then, as far as seasoning was concerned, one of the measures was better planning and switching from artificial condiments to natural condiments, as I mentioned before, preparing them and refrigerating them or freezing them. Also using natural broth, preparing broth at home so as not to use the bouillon cubes, which, as we know, are high in salt and sodium content, as well as saturated fats. Changing the way we cook. Also taking homemade meals to work and trying to eat healthier at work. So these are some of the actions identified in the survey. So many of the participants said, but why doesn't the Ministry of Health have a restaurant or cafeteria? We can go and buy healthy foods. So that was interesting. And it led us to another strategy, which involved presenting a proposal to the Ministry of Health authorities. So in the planning and initiative processes, we identified the main audience, the target audience, also the secondary audience. The primary audience was our colleagues between the ages of 20 and 50, and the secondary audience was the families. Influencers were health professionals. The key promise is if we reduce our salt consumption, we will prevent diseases like high blood pressure and heart disease. And it's also a healthy way to meet our needs and those of our families. Also, it's nice and pleasant to prepare and consume healthy foods in the family using less salt. Also, reduce artificial condiments. So our target was to add more natural seasonings to our food on a daily basis and reduce the use of artificial seasoning. Next, so the planning process, here's the creative concept. The slogan was use natural elements to give your food a better taste and better flavors. We already have a preliminary version, which includes recipes that are low in salt and sodium and which uses natural seasonings. There's also a reminder. It's a large wooden spoon, which is something widely used in our country, especially in rural areas. And the message is use natural seasonings to color and season your food. So this is something they can keep in the kitchen, and it's a reminder for the person who is preparing meals. We also have stands that are being used at fairs organized by the Ministry of Health. And these stands provide information about how to prepare foods and also gives participants brochures about the use of salt and sodium. And then those who participated are going to be receiving some small potted plants, herbs that they can keep and grow at home that are easy to care for. Next. So next steps, we're told that we should save this until the end, but here it is, launching a communication strategy, carrying out workshops for colleagues on communication strategies, distribute communication materials, develop a collection of plants and herbs, presentation of the stand, and next. During the process, we were, as part of our lessons learned, and this is true for those of us who led this initiative, we were able to see that social marketing can make it possible to implement strategies to bring about positive behavior changes. Also, it's important to target key audiences with clear and specific messages. And any interventions will be more effective and will have a better cost-benefit ratio if based on social marketing. And the social marketing analysis methodology is appropriate to bring about effective and sustainable behavioral changes, and it also guarantees more effective and appropriate strategies. And this is Panama City at night. And with this image, we end our presentation. Thank you. Thank you very much. It was also very interesting to hear about your experience. We are seeing some questions for you in the chat. Maybe you can answer them there as well. We'll move on to our last presentation for this panel, which is from Costa Rica. It's by Carol Madriz Morales, and it's about the use of sweetened beverages in schools. Thank you. It's a pleasure to be here with you this morning. I will start my presentation, which is the proposal of strategic plan to reduce the consumption of sweetened beverages in the adolescent population. The team includes Adriana Bolaños Cruz, Jose Cambronero Miranda, and myself, all with the Ministry of Health. Go ahead. Background and health issue. As you can see in the first graph, the adolescent population in Costa Rica has a growing trend when it comes to weight and obesity. It was 20.8% in 2020, and according to the 10, and it went up to 30. We have seen that adolescents consume 75 grams per day of added sugars, and this exceeds the recommendation of WHO and BAHA, which is 10%. And the main source of these added sugars are soft drinks, which account for 23.7%. Also, they consume these drinks 2 to 6 times per week, and that is 33.1%. So we're concerned by the high consumption of added salts, especially in these sweetened beverages. It can increase calorie intake and also reduce calorie intake from nutritional foods. So this leads to an unhealthy diet because there's a lack of nutritional balance. It can also lead to overweight and also raises the risk of non-communicable diseases, which account for the high rate of mortality and morbidity, high healthcare costs, and also the loss of economic resources. In order to address the situation, we have a national strategy for a comprehensive approach to NCDs, which includes an action plan. And there's also nutritional guides aimed at the teenage population, which contains key messages that are aimed at reducing the consumption of carbonated sweetened beverages. The marketing plan we are proposing is as follows: to help reduce the consumption of sweetened diseases for the prevention and treatment of obesity in the adolescent population according to the established target. Our main audience is adolescents between 12 and 17 years of age. Secondary audience is parents, teachers in schools, and other personnel working in school cafeterias. The formative research results are as follows. The barriers mentioned by adolescents when asked about reducing their consumption of sodas are: 1, addiction; 2, lack of willpower; 3, the environment at home. Parents buy these drinks and bring them home. The fact that they taste good and water does not. And the fact that they are more filling than water. And barriers they identified as to why they don't consume more water. Water is not refreshing. It has no flavor. They don't have water bottles. They don't have easy access to water. It's difficult to develop a habit to drink water, and also the fact that they do not like to drink water that is not chilled. Motivators or benefits they reported more frequently regarding the consumption of sweetened beverages is pleasure, taste, convenience, and popularity. And as for reducing the consumption of sweetened beverages and increasing water consumption, they mention health, to have a better nutrition, and being more fit. The literature also indicated that adolescents consider the need to protect the environment because they're more environmentally aware. Based on the results of the formative research, we developed the creative concepts considering the aspects adolescents identified when it comes to health, nutrition, environmental protection, flavor, taste, freshness. And with that, we developed a value proposal based on using natural products that are not processed and that contribute to our health. We also established connections with the different ideas in the creative concepts and come out with a convincing message for adolescents that could change their behavior, which in this case is reducing the consumption of prepackaged sweetened beverages and have them choose water instead. Based on these analyses, we developed a number of slogans, and you can see them here. These are the messages we plan to share with this population. For my health and to protect the environment, I will reduce my consumption of packaged sweetened goods. I drink water for my health and for the environment. Hydrating oneself is a natural and sugar-free way to be healthier. So we'll try these messages with the target audience before they are used in the campaign. We identified objectives and targets. Knowledge, beliefs, and behavior are the different blocks, and we intend to use these to convince adolescents to reduce their consumption of sweetened beverages. Here are some examples of behavior goals. One, reduce the consumption of prepackaged sweetened beverages. To choose water instead of sweetened beverages. Flavor water using seasonal fruits and vegetables. Always carrying a water bottle. Convincing parents to stop buying these beverages and bringing them home, and use nutritional labels to select beverages that have a lower sugar content. After this, we developed our marketing mix, which is aimed at convincing adolescents to change their behavior, considering the 4 Ps. In the product strategy, we identified the product, which is reducing the consumption of sweetened beverages and increasing the consumption of water. And we list all the benefits for the population, the target population of doing this, having a more natural lifestyle, being refreshed, healthier, improve their physical performance and fitness. And we have a list of measures that can be incentives, like providing bottles, water bottles, also providing them a stickers album, also giving them free access to an interactive web platform where they can access open educational content, videos, and other such elements. Next. The pricing strategy, at first we identified all the costs or barriers identified by the target population. And after that, we developed a series of actions or interventions to be carried out in order to overcome these barriers. For example, in food preferences, the barrier identified was the lack of flavor and freshness of water. So the idea was to have cooking or gastronomy workshops to teach adolescents how they can prepare flavored water by using different herbs and seasonal fruits. Also, we identified places where the target population can carry out the desired behavior, for example, food cafeterias and at home. And we identified strategies that can be implemented to generate the means and conditions that would enable the target population to reduce its consumption of sweetened beverages or increase their water consumption. Let's say at home, if one of the barriers is that at home they're exposed to sweetened beverages because their parents buy them, we think it's important to raise awareness among the parents of the issues related to sweetened beverages and the benefits of increasing water consumption. We also need to involve other social players and intermediaries who may play a role in these interventions. In this case, the Costa Rican Social Security Agency, the Ministry of Agriculture and Livestock, among other partners. In the promotion strategy, we identified different activities that could be carried out to disseminate our message. For example, preparing a communication campaign on how to reduce the consumption of these beverages and increase consumption of water with the risks and benefits. Also, identify challenges using an app or web platform where teenagers can get points that they can then use for movies, to get discounts, and then also have campaigns by visiting educational centers, using our value proposition ideas, and use songs or plays and rallies to engage adolescents.
Communication channels were also identified where messages can appear, like social networks, apps, text messages, viral memes, etc. And also the youth themselves, artists, officers, and the celebrities can be used to promote the message. Now, the lessons learned are very important, and we need to define them according to the experiences of the best practices. In Costa Rica, we used our prior experience to increase the use of produce and fresh fruits, etc. And so we also did work focused on people, considering all the different values, the motivators, and the barriers and challenges in order to identify what substitute actions can we provide and offer so that we have the behavior changes that we want to achieve. Multi-sector approaches are necessary. One of the greatest experiences in this course was to be able to learn about the experiences of the different countries and what their experiences have been, and to also have the commitment of the authorities so that they can continue to support these campaigns. Thank you very much. And that's it for me. Thanks for your attention. Thank you. Thank you very much for your presentation. It's a very interesting topic. Yes, of course, social marketing can be used for any topic in public health, as we've seen here, and each topic needs its own analysis. And unfortunately, in many countries, it's necessary, or when you are trying to make a campaign, we begin by thinking, well, what are we going to put on the posters or the brochures without going through the whole process of doing formative research and defining the problem first and what the benefits are for the target group. So I think this is one of the purposes of this program, to create more capacity, to have capacity building so that people in health ministries get this training. We have a few minutes left for some questions and answers. I see that there are many questions that have already been answered in the chat. I wanted to ask something to all panelists, and this is the question. Now that you've gone so far designing your campaigns, what are your next steps, you think, and what are the plans to implement these campaigns? And so let us begin with our colleagues from St. Martin and Aruba, and Ariana and Sana, please, over to you.
So I can start. Yes.
You can start.
Thanks
Okay.
for that question. So in terms of implementation of this specific campaign, yes, we are moving forward with the three activities that we designed. So including social marketing, social media advertisements in markets, and cooking workshops. So those concrete elements will be implemented before the end of this year, all of them, and then we'll evaluate just where needed, and also think about taking this particular campaign forward and into the next years, and see how we can keep on adjusting and tweaking it. If we're talking about the the whole concept of implementation of social marketing, behavioral change campaigns. I think the course has been very informative, and we intend to do this, practice this similar methodology more often in the future. So what I'm doing personally, because I was a participant in this course, is making some taking the teachings and lessons that I received into a shorter training package for the people in Sint Maarten. So that includes my colleagues from the government, and also we're thinking about including other stakeholders, just so that we can disseminate the teachings from this course within the country.
Thank you very much, and that sounds very good also to involve other colleagues. So that's great. Okay, then let's listen to the colleague from Aruba as well, Dariana.
Yes, for the continuing implementation, we would have to. It's nice that the social marketing as a tool was able to create a name for what we were doing already. Similarly, one thing that was very important, the monitoring evaluation aspect for us, which is still ongoing, it's something that it allowed us to really break down each aspect, connecting with the stakeholders that are relevant for us to implement it properly, and also doing the pre and post survey will really allow us to analyze as to what is the impact, how high is the impact, where can we create guidelines accordingly in order to connect it with policy that we would need to do it as well. And one aspect of the communication plan, as previously mentioned, it really created a specific design that was customized for our community and using the resources that we have. Because a lot of the times we depend on social media in order to bring information out there. But now we've realized that it's not only social media, we would have to bring the access and information as well in the field, which was bring it to the community within the hotel sector and other working environments that they're currently at.
Okay, thank you very much. Entonces hacemos la misma pregunta al colega
Now we
de
have the same question for our colleague from Panama. What are the next steps in implementation, and what are the concrete plans, and how you're going to disseminate your learnings with other colleagues in your country? Yes, well, our intention is once the process has been completed, after doing the pilot project, we would take it then to the regional areas in 15 um, health secretariats of the country, and we have um, health promoters in each one of those 15 health regions of our country for implementation purposes. So this will allow us to reach more people from the national level, then regional level, and then local level. And so at the local level, we will have direct interaction with people. So once we're done with the national level, we will go down in levels to the regional and local. Oh, yes, thank you. Now we would like to hear from Costa Rica what your plans are for the near future. Yes, we've discussed the importance of continuing to train people at the level of the ministry, and also mobilize resources so that we can fund the process of implementation, monitoring, and evaluation. On the other hand, we also would like to take advantage of the work that has been done. And definitely, we see that the different creative concepts and the slogans created should be kept. It's important to have this material that makes the population like what they're hearing, to make them be identified with this. And so this is important so that the implementation phase can continue and people buy into it.
There's a question policies he would like to respond. And there's just another question coming in, which I think is also interesting. It's about how many people are typically needed in the field to successfully complete a social marketing project. So let's listen to Mahmouda.
Sorry, Leo, can you ask that again? I was just typing the question.
Yes, the question about the public policies, it's for the integration of the work, if
Yes,
the public policies are taken into account, and also how many people are typically needed in a unit or team in the field to successfully complete a social marketing project.
So I'll answer the first part, which is that there isn't necessarily a minimum, but I think it's always good for social marketing to have a couple of individuals working together, because if you're going to be engaging in the research component, and then also just to pull the work together. So I would say a minimum of 2 is starting point, or 3 people, and that should be sufficient. Regarding the integration of policies, that was a question that was very interesting that I saw, and I thought it would be a good question for some of our country teams to respond to, especially I believe with St. Martin and Costa Rica, because they addressed it in their presentation. So that question I wanted to actually send back to the country teams to see if they're able to respond to it in terms of how they're integrating their work into the larger policies that may exist within their countries.
Okay, let's then first listen to Aruba. How is this, how you integrate your campaign into the public policies of the country?
Yes, for the integration part, initially when we launch the campaign next week, it directly involves the Department of Public Health, which is under the Ministry of Health, and our collaboration within our team, we had also the Ministry of Sports. And the point will be like, once the implementation is starting of the campaign, we will be writing a report for our ministries and presenting it to them, because that's where the part of the policy can be created as well. And the adjustments that we do along the way will be with the policy advisors at the Department of Public Health, which is connected within the ministries. And we hope with that in the future to be able to create specific adjustments and guidelines that we can implement in Aruba as a whole when it comes to salt products, the labeling aspect of as well as what is given as nutritional products within the not only the hotel sectors, but available for working people in general.
Thank you very much. Escuchemos también a Costa Rica, como ellos.
Now we would like to invite Costa Rica to tell us how they have integrated the social marketing within the policies. Yes, we have already implemented some of this with the adolescent population in my prior work with reduction of salt and sodium. We started working in developing messages for the adolescent population, creating value concepts. We created the messages, and then after that, we did a validation process. So we've been able to use social marketing strategies to disseminate the values that adolescents have to keep a healthy nutrition. And we've also encouraged reduction of salt and sodium, emphasizing a plant proposal from the government. We have had a policy brief as well as some scientific activities, and we've been doing some lobbying with the authorities so that the authorities will consider social marketing strategies as something that is effective to position health among the population as something important and for its sustainability. It is important to continue to sensitize people with social marketing to leave behind traditional strategies of communication, education, and dissemination, and to use social marketing as a best buy, which it is, and so that governments start investing more in social marketing. So we see the importance of social marketing. It is not an isolated strategy, but it complements other policies and programs. And it is not only for to cause an individual change of behavior, but for social change at a larger scale, and it can be used for lobbying purposes. The program continues the program is ongoing, in other words, and we have um, put the information there. It is available both in English and in Spanish on Bajo's virtual campus. And we still have the self-learning portion of the course. And up to now, 16,000 people have registered to take the course. And we hope that you all here are willing to take the course and then tell your friends and colleagues. We don't have a tutorized option right now, but we hope to have a tutorized modality in the future. I would like to thank the American Heart Association and all the colleagues who have contributed to making this course possible. And also, let me underscore that this is an interprogrammatic exercise, not only for risk factors for NCDs, but it it crosses over to other work carried out by PAHO. And I'm very happy that Dr. Jerry Eikemans is here with us. She is the head of the new Department of Social and Environmental Determinants of Health, and she will give us some final words. Thank you very much, colleagues. Good morning or good afternoon. Guten Morgen.
It's a real pleasure for me to be here with you, have listened with attention to
Es
all
un
this
placer estar con
work
ustedes y
that
haber
has
escuchado
happened over the last years. Only a few years ago, in July 2020, we were in the beginning of our pandemic. I also joined this discussion when we were launching as an organization this social marketing program. And then I already emphasized the importance of social marketing in the framework of health promotion and of addressing social determinants of health, emphasizing the importance of embedding social marketing in a broader framework and context. And I heard a lot back from you on this. Meanwhile, a few years later now, we have a new director in the organization, Dr. Jarbas Barbosa, who took office in this year in February, and he created this new structure. Today I'm here with you as this director of this new department on social and environmental determinants of health equity. And it's really a pleasure to be here. And I think there are a lot of things that you have mentioned where we can collaborate and work together. We do already a lot of work together with Leo and with other people in the team of the Department of Non-Communicable Diseases and Mental Health to reiterate the importance of intersectoral, interdisciplinary work as a key aspect to promote health, the importance of participation, empowerment of the population that plays an active role in advocating for health, and to push government to meet their responsibilities in addressing health inequity and, through agendas that reduce the risk factors for NCDs, etc. We've heard from our collaborating center on the main aspects of the program, success that has been achieved. I'm hearing that there's already 16,000 people enrolled in this program. It's absolutely excellent. So I think we have a great future here. We also heard some of our professionals from the Ministry of Health, Aruba, Costa Rica, Panama, St. Martin. And some things I take away is the importance of identifying and understanding your audience, understanding what are the barriers, what are the drivers of of behavior, and doing this through formative research, really necessary to design a successful campaign. Also, I see a lot of the challenges that countries face when we implement social marketing. It has to be part of a bigger agenda. Of course, we are always competing with for resources with other priorities, but I think this is the challenge of pushing this forward, of scaling it up, of making sure that it reaches everybody is huge. I'm hearing that from you. I see creativity that is needed and that you are using to overcome the limitations, to overcome the barriers, and of course the potential that all those trained people have in the ministry. So one of the flagship projects that our new director has put forward is scaling up the NCD action using primary healthcare. And we are working very closely with the colleagues, with Leo and Dr. Hannes, etc., to ensure that those programs integrate an equity focus in their planning, in their implementation, in the evaluation of their strategies, programs, activities. And this is very important to ensure that we increase the effectiveness of the interventions, that we really reach the people that we traditionally do not reach. And this also very much is related to the work that you're doing. And it brings me really to the importance of taking into account the context, the conditions of the populations that we are targeting, to address those social structural barriers that prevent people to really make healthier choices in life, to tackle those very structural, contextual factors that influence and determine people behavior. I've heard it from you, but I'm giving a couple of examples here. Social marketing will be effective in changing behavior if we follow a couple of conditions. Now, if we take into account those living and working conditions or situations that allow people to change their behavior, of we saying, making the healthy choice the easy choice. Income, we've seen it now. Can people really afford healthy food? Why are they be driven back to unprocessed food? This also has a lot to do with what we call the commercial determinants of health. We have, particularly in our big cities, urban food deserts where people don't have easy access to supermarkets. It's much easier to go to a McDonald's than to a supermarket. The cost of vegetables and food in small Caribbean islands where you would think it would be easily available, it's not. It's too expensive. So this is one of the elements we need to look at. Time. Do people have time for the cooking and the classes and the courses that we are offering? If not, how do we need what do we need to do differently to scale that up? Do people have time to exercise? Many people to survive have 2 or 3 jobs, and time is a real scarce resource. Also, the issue of availability of water. This is a big thing, and I saw that also in the presentations of some of you. I worked in the highlands of Mexico, and it was almost impossible for the people there, the indigenous populations, to buy water, because it was much cheaper to buy a soda, to buy Coca-Cola, and easier and cheaper than to buy water. So these are things, again, that go beyond the scope of the health sector, but are really important. And then looking at those populations, our migrants, our informal workers, do we really reach them? So I think it's really important to embed, and I heard you say this in different occasions, but to really think to go beyond making the people, the individuals responsible for the health problems and the health behaviors, not to blame the victim. It's important to go beyond that, to go beyond giving information, and to really work on intersectoral action. I think if we do social marketing and we do not work with those sectors that are responsible for the policies on agriculture, on trade, what do we import, how do we label, on labor, what foods are available in the workplace, what drinks are available in the workplace, with education, with housing, with transport, with social services, with economy, where are the subsidies, where are the taxes? I think it's very difficult to make progress in people's behavioral change. Knowing is important, but it's much more important to create and the environment, and to tackle those barriers to do that. Now, really talking about health in all policies, and this is not easy. But I think it is absolutely central that we allow people to apply the information that we're giving them. The work with municipalities, obviously, this is a very much at local level where we decide on those policies. So do we really work with the mayors, with their teams? To boost, social participation? Are we using the networks of the communities? Do we really work with the communities and understand what they want, what they need, what they can afford, and how we can be more effective in our interventions? So in short, I think social marketing integrated with other policies and other approaches is very important, a very powerful tool to improve health. Now, if it is embedded with this broader health promoting agenda using a social determinants approach, if we work in an intersectorial manner, if we work with our populations, and particularly those in situations of vulnerability that we never reach, are we taking into account these conditions of those populations when we roll out our social marketing strategies? And if we manage to really make healthier choices the easiest ones. So again, I really want to congratulate everybody who's pushing this agenda in PAHO and WHO, but particularly in our collaborating centers in our countries, because that's where things are happening. You can count on us, on our health promotion and our social determinants of health colleagues and experts in PAHO and in headquarters, but also in your country offices, to work with you on those implementation strategies of implementing behavioral change strategies in a broader context. And I'm really looking forward to being back with you in a few years and to see even more progress and even more health for everyone. Thank you so very much.
Thank you very much, Gerry, for those reflections. Very, very useful. So with that, we are coming to the end of our webinar. We have had 220 participants, which is a good number. So this topic is really of interest of everyone, and really cross-cutting and really important to work at as part of a bigger program. So just to let you know that on our webpage in a few days we will post all the presentations and the recording as well of this webinar. So please come back and consult the webpage, and you also have the links to register for the social marketing program. So hope we are in contact, and see you next time, and have a good day. Buenas tardes a todos. Gracias.